Hello, welcome to this edition of Health First. Today we will hear from Rixie Smith, RN with our Cardiopulmonary Rehab Department, and Brandee Chamblee, our Wellness Coordinator here at CRMC. Stay tuned.
I'm going to talk a little bit about cardiac and pulmonary rehab and then give you an opportunity to ask questions. I'm using the slides from our national organization. Cardiac rehab deals with people that have heart disease that the physicians refer, and we do exercise and a lot of education. And then the pulmonary rehab deals with your lungs, and we do a lot of exercise, breathing retraining with the pulmonary program, and a lot of exercise with it. Cardiovascular disease includes your coronary artery disease, stroke, high blood pressure, heart failure, atherosclerosis, peripheral vascular disease. And of course, heart disease affects a lot of people. It's probably the #1 killer. I'm just going to flip through these slides quickly. Okay, what we really get into in cardiac rehab is risk factors for heart disease. Some of you may have some of these. Your uncontrollable is age, gender, heredity. Those are things we can't do anything about. Controllable risk factors are what we try to work on every day. Tobacco use. You know, the first thing a heart or lung doctor is going to tell you is to quit smoking, quit using tobacco products, because nicotine constricts your blood vessels. That can raise your blood pressure, make you more likely a candidate for heart disease. Your lipids. How good is your cholesterol? Do you keep up with that? Does your physician keep a check on it? Blood pressure. Is your blood pressure consistently 140/90? If it is, you need to see a physician about it. Physically inactive. How many of you are active at home, or do you sit, watch TV, and don't do a whole lot? And excess body weight. As we get older, we tend to become more sedentary and put on a little bit more weight. Diabetes. If you're diabetic, do you keep your blood sugar under good control? And stress, which everybody has this day and time. What is cardiac rehab? It's an education for lifestyle modification and exercise. We go through the risk factors for heart disease. If they apply to an individual, then we go into great detail on how to better control that risk factor. It's very supervised in cardiac and pulmonary rehab. Our staff is RNs. It's myself and 2 other RNs. It's an outpatient service, and it's located in Professional Office Building 1, and it's located in the rehab center. Our days are Mondays, Tuesdays, and Thursdays, and we're open from 6 to 6. You're seeing a lot of younger people with heart disease, and they're having a lot of coronary stents put in. So our program is open to accommodate people going back to work so they can come early or late evening. It's supervised. We go over nutrition, blood pressure, cholesterol control. We deal with trying to get people to quit smoking, stress management, weight management. We have a dietitian that can come in. We have group classes on cholesterol that the physicians, Dr. Pinehart is involved in that. Dr. Rutledge does the medication part. Howard Rogers does the stress management part. Our dietitian comes in on the dietary control. What's the benefits of cardiac and pulmonary rehab? You have improved functional abilities. It helps improve your quality of life. Makes you feel better. I've had so many patients start the program and say, I just don't think I can do this. We progress patients according to what they can do. You wear a heart monitor. We do blood pressure, and if you're a lung patient, we do oxygen sats. On our lung patients, we teach a lot of breathing retraining, teaching you to slow down and do your pursed lip breathing. You wear a heart monitor. We do your blood pressures. We'll do a warm-up and cool-down, usually walking the track slowly, and then we've got various pieces of equipment. We've got treadmills, we've got various types of bikes, we've got arm ergometers, rowers, trainers, steps. We work with the patient to make it fit for you. If a piece of equipment hurts you, we change it up. All right, Medicare and most insurances cover cardiac rehab for these diagnoses. If you've had a heart attack within the last year, bypass surgery, angina. What's angina? That's when you get out and you get short of breath, you have tightness in your chest, you may have congestive heart failure, and a lot of our congestive heart failure patients come under the diagnosis of angina. Then if you've had a coronary stent, valve surgery, maybe you've had a mitral valve, aortic valve replacement or repair, and then heart transplant. Now for our pulmonary diagnoses, that would be like COPD, your chronic obstructive lung disease, and under that you've got your emphysema, your bronchitis, then you've got asthma, you've got lung transplant, pulmonary fibrosis, and various other lung diseases. And again, it's covered by your Blue Cross and your Health Springs. It's just a lot of different insurances, but what we do in the rehab center, we have a wonderful business office staff, and they always verify the insurance up front, so I can tell a patient when I call them to get them set up for their evaluation visit what their insurance is going to pay. We can go up to 36 sessions. You would be coming 3 days a week for up to 12 weeks. After you complete cardiac or pulmonary rehab, you have an option with us and stay in a supervised program. It's self-pay. We have a fitness program now on campus. A lot of people do their home exercise. We've got you doing a home exercise program while you're with us, so when you complete the program, after being monitored, you feel very competent with what you're doing at home. And if you want to continue your home exercise, that's fine. But the main thing is don't give up everything that you've gained. And you can lose it in 2 or 3 weeks, what you've worked for 12 weeks. Our medical director is Dr. Pinehart. You have to be referred by this program. So if you have heart or lung disease, talk to your physician and they can do the referral. Like our program is made up of nurses, we have a dietitian. Cardiac and pulmonary rehab will give you the tools, the knowledge, and the motivation needed to fight the progression of cardiovascular disease and pulmonary disease. We work with you to make you feel better. Any questions? That was kind of short and sweet overview.
Quality of life. It's an exciting time here at CRMC. As she mentioned, I'm the wellness coordinator, and we're doing a lot of focus on our employees' health and wellness and fitness plan, as well as our patients. So I recognize a lot of you. Some of you have been in my pool class, Miss Barbara, that just spoke, and I remember a lot of you, and some of you I remember too, back when I was fitness manager there at the Aquatic Center. But it is exciting. We've returned back to campus and just put a big focus on our employees, their health, their fitness goals, and then we've also been able to transition into our patient fitness, which is a great thing. So as far as fitness goes, you want to stay active. Anything that you can do to keep moving, to stay well, you're going to prolong and keep those risks away from cardiovascular disease, type 2 diabetes, there's cancers, osteoporosis, fibromyalgia, reducing the symptoms of stress, anxiety, depression, all of these things that put our health down. Exercise and physical activity will reduce greatly. So 20 to 30 minutes a day is a great way to start. If you could just take a good walk, if you can do, of course when it warms up, some gardening, any activity from chasing grandchildren. I know many of you have grandchildren, that'll wear you out in itself. So any physical activity, choose things that you like to do, that you want to do, that's fun. It also helps to have support. Grab a friend. It's too easy just to not want to do it if you're by yourself and you say, oh, well, I'll do it tomorrow. But if you have that friend that's calling you saying, come on, we've got to go. Let's go shopping. Let's go walk. Let's go see this, see that. It keeps you out. It keeps you active. And that's what you need to do and focus on. So just remember that. Any activity, it's proven. Trust me, with our wellness program, we saw great results in a month's time. 1 week of changing your diet and exercise will reduce your blood pressure and reduce your cholesterol. Promise you, it will. So you just need to make sure you're making healthy choices. When it comes to diet, everybody thinks, oh, you've got a strict diet. And there are plans out there that are, and those are lifestyle changes, things that you're gonna wanna stick with. But the biggest thing is just healthy options. Push back your portions, try to cut that in half. Choose your better options as far as lower salt, lower fat, lower calorie. And make sure you're picking a choice of a protein, a fruit, and a vegetable. Those things that, we love. We also love fried chicken, but if you're gonna do that fried chicken, just remember to up that activity because you're gonna need to burn off the grease that it was fried in. So pick those baked options, pick those, fish, chicken, those things that are healthier. Those are gonna help you to maintain, lose some weight, but also feel better. And use your body for the right type of energy to burn calories and to stay well. You'll sleep better. All of it plays all in a hand. So just remember, arthritis too is another one. I know a lot of us suffer from those things that maybe keep us from being active. Arthritis, fibromyalgia, things that make us stiff, autoimmune disorders. I myself are going through things like that. So those things you feel like I can't do it. I don't feel like doing. I don't want to do it today. Push yourself. I promise you, if you can just wake up and tell yourself, I'm going to feel good today, I'm going to get out and do a little bit. If you can do a little and each day add on to that, you can fight it and you can start to feel better. And I know it's tough because we do have those days where our joints just ache and they hurt and we just don't want to move, especially cold days like this. We want to stay inside, we want to bundle up and not move. But there's things that you can do at home. I'll grab a chair here. I know many of you, if you're at home, feel free to grab, thank you. Grab a chair. You can do things like leg lifts, lifting your leg, doing several reps and sets of three sets of 10, to where you're going to lift your leg in front, lift it to the back, lift it to the side. If you'll focus on that, using your muscles to strengthen and tone, that's going to help your core with your balance and those other things that are going to keep us from falling. Because that's one of those things, as we get older, we tend to fall. I fall now, but just you want to make sure you're keeping your core strong, so that's going to help your balance to where you're not going to fall and put us at a greater risk for hip replacement, knee replacements, those things. So knee extensions, work on those knees. Those are usually the first things to go. So make sure you're keeping those healthy and active. You can do 3 sets of 10 of those. You can do it sitting in a chair. If you are one that can't get up and is very mobile, or you have a family member that's in a chair, have them do these same exercises in a chair. They can lift their leg. They can do knee extensions sitting. You can grab cans of vegetables and do arm raises. You can do bicep curls. So don't feel limited to not being able to do things without an exercise program or a gym. You can do it. But then that's the good news. The good news right now is that fitness and wellness is everywhere. Most every company, every insurance policy out there is incorporating a wellness program. I'm not sure if many of you know, but C Plus has added that. Used to be Humana and Health Springs. Most all companies are adding a wellness policy in there that if you participate, they'll cover your program. So there's different places. You'll just need to check with your insurance companies. I know there's several around town that participate. So just check with them to find one that will, and you can be active in that. The program is Silver Sneakers. We were real familiar with it when we did Sports First and when we were at fitness there at the Aquatic Center. But just check with your insurance company. Many of them are providing you that opportunity. And why? Because if you're active and you're healthy, the healthcare costs are lower and it's reducing your health risk. So it's a very positive thing. It's the same thing we're doing here at CRMC with our employees. We want them to be at their best health so that when you come see us, we're healthy and we're going to make you healthy. So it's a great opportunity, a lot of exciting things for us. As fitness and supervised fitness on campus, Rixie talked a lot about that. With us coming back, not only our employees, but our patients. If you come through physical therapy or occupational therapy or cardiac therapy, after you've read all, you've met your insurance, your visits are done, time to go home, just like Rixie said, you go home, you just fall off the wagon, you don't keep doing it, and guess what? You come see us again because you didn't stay with it. We're providing the opportunity for you to stay and to keep staying, to continue your exercise program, to stay on the right track with the same machines, the same equipment, the same program that you were doing while you were here as a patient. So it's a great opportunity. It is a low cost. Our fitness program is $20 a month, and our supervised fitness program is $35 a month. It is one of those things that you can transition out of therapy, referred by the therapist, and keep on doing those exercises. We operate 5 days a week, so it gives you more opportunity in different days to do it. We have different times. We have to operate around our patient care, but it's still plenty of different days and times that you can come in, do fitness on your own. If you know that program, you're comfortable, you're independent, you can just come in and do your program. If you need a little bit more supervision, say you were a stroke patient that requires some assistance machine to machine, or one of our cardiac patients who still need to have their O2 checked and their blood pressure checked, we can supervise that. Take you through the same program, watch you, supervise you, and keep you going. So it's a great opportunity to stay with it and not just, stop and lose, like Rixie said. You can lose it within a week's time. So it's a good way to keep going. I'll just tell you a quick story. We have one of Rixie's patients who transferred in. He's 90 years old. He is the greatest thing ever, and I want at 90 to be kicking and running like he is. He comes in every morning, 4:45, and with Rixie he was 3 days. I promise you, I think I see him 5 days a week. And with our wellness program, when we opened up Saturdays and Sundays, I came through Sunday, and guess who was there? He was there, 90 years old, on the treadmill, just to go. And so, it warms my heart. I think it's a great opportunity. I think it's inspiring. And those days that you feel like, I just don't want to do it, just try. It's contagious. Our employees have learned that, we're requiring some to do the 2.5 hours, and it does say that 2.5 hours a week is a great plan. If you can get in 2.5 hours a week of physical activity, you're going to reduce any of those health risks. So, just try it. Get a support system. Make yourself accountable. You can make yourself a journal, set goals, track your goals. Any of those things that are going to motivate you just to stay on track and to stay healthy. So, again, I'm excited about it. I'm passionate about it. I hope that, you'll just try it. And like I said, I think if you just do it a few days, you find that you feel bad if you don't do it. So it goes from not wanting to do it to just getting up and wanting to go for that walk. After a heavy meal, you just, if you go and sit down, guess where that meal stays? Yes, right there. We love our pecan pie. We love all that. It's great, but we go sit down, especially through the holidays. How many you ate too much? But it just stays with you. So take a good 20-minute walk. Just get active. Do something to just feel better. And I promise it long-term results if you'll stick with it, okay? Any questions? Anything that I can do to help? Or
does water aerobics do as much as machines do?
Yes, water aerobics, and that's where I know a lot of you. I used to teach all of them. I teach some now, but water aerobics is a great program. One, it's low impact. You're in the resistance of the water, not the resistance or the weight of a machine. Plus, it's just a good cardio workout without the strain on your knees. It's great for those who maybe have had hip replacements, knee replacements, back surgeries. Fibromyalgia, my mom's been coming for over at least 12 years, 3 times a week, hates it when she's missed it. And actually, she's going to have a knee replacement next week, and so she's sad that she can't get in the pool for a few weeks. But it's a great program. We do offer that 3 days a week, Mondays, Wednesdays, and Fridays. It's $35 a month, and that's open to anyone. You don't have to be a patient or an employee to that. So you can contact the rehab department there. We'll be glad to get you to set up in that program. A lot of patients in that program have come out of therapy and are recommending it. We have pool therapy that we do, but then you can do the water aerobics classes. Our pool is 92 degrees, it's very nice and warm. It's salt water, and it's a very good program. Like I said, it's a great workout without the strain.
Brandee, thank you so much for the tips and exercises that you shared with our senior choice group earlier. If you could you show us some additional exercises and tips for people who are experiencing problems such as arthritis and fibromyalgia, things that are having, people that are having difficulty with their joints? Is there special types of exercises and
you just want to be careful, and a lot of times with fibromyalgia and arthritis, you tend to not want to do those things because you're afraid it's going to hurt or damage more. You do just want to be careful, safe, low impact, maybe not as much weight, but there are some exercises you can do to keep the joints moving so they don't stiffen up. You want to try to work out that soreness and the pain from the fibromyalgia, because with that it is just deep soreness in the muscles. So anything that you can do to move on a low impact level, but yet keep the joints moving, keep the muscles moving to increase your tone and strength.
Right, okay. And can you show us or maybe give us some examples of some of those types of exercises?
Sure, I'll be glad to.
Okay.
All right, earlier I did do a few exercises where we were talking about doing some leg lifts. The one thing is just make sure you're in a safe environment. If you need to hold on to something, you can grab a chair or a table or something that you can do to keep your balance. But like I mentioned earlier, doing the leg lifts where you're doing several sets or reps of each exercise. With your knees, hips, and everything, you want to make sure you're moving the joint, making sure you're tight and standing up straight. You can do 3 sets of 10 here where you're lifting your leg to the front. On your knee, if you are experiencing some knee pain, knee joint pain, you can do your knee extensions where again you're doing 3 sets of 10 to 15, increasing your reps, increasing your number as you go, and that you feel, just as long as you're not putting any pain or pressure or causing it any more problems. You can lift them out to the side, stand up, as well as when you're doing this with your arms, also standing or sitting. I'll show you some sitting, but we do a lot of these exercises in the pool, which we mentioned that pool aerobics was really good for fibromyalgia and arthritis. But if you'll either grab a like can of peas, or even if it's just a light set of weights, but you can hold cans and just lifting your arms to the front, pushing them to the back, lifting up, pushing to the back. This is working your shoulder joints, lifting and increasing that tone and strength there. You can also take them up out to the side, lift them up and bring them back down. Just a good slow increase. You don't want to go too fast. Right. Just take the time to really just focus on those muscles and bring it back down. You can lift it out same weight in the front. Also bring it in. You can push it up here. Take your cans or your weights, lifting up. And again, everything that you do, you want to do 3 sets of, like I said, 10 to 15. Bicep here in the front. Okay. Just making your sets and your reps. Same thing for those that need to sit. You can do all these exercises in a chair, whether you're just lifting your legs up. By doing this, if you'll try it, you actually are using your ab muscles. You want to focus on tightening your tummy, keeping your shoulders up, again, working on your core, which is going to help your balance and strength. So anything just to lift, you can do those knee extensions here. Again, focus on just keeping good posture, holding yourself up. If you do anything relaxed, you're not really doing anything. So focus on a good posture, keeping those muscles tight and squeezing everything. Same thing here, you can sit in the chair. If you're not able to stand, you can do those same arm exercises here with your can or a lightweight or without anything. Just movement along of squeezing and using those muscles. Here to the front, or the same as reaching over. You can also work on the back of the arms here. All of us old ladies, we like to tighten up this area. Bend back and press up. Bend back and press up. Also just stretching, flexibility. You want to keep everything loose and not so stiff. So just even taking the time to do neck exercises where you're taking your chin down and you're reaching and you're looking up and you're taking your chin down. You can take your knee to the, your shoulder to your ear to your shoulder and then to the other side. Just stretching everything out. Also your shoulders, you can take your arm across, pull and stretch. Same thing here, stretching it over. Do each exercise again 8 to 10 seconds, working your way up. You can lift that knee, roll those ankles around, loosen up here. And as far as like standing, you could, even if you're in the bed, when you first wake up, there are things you can do lying down to where you're doing leg lifts and stretching everything up. But just a good stretch, you can reach over, stretch out your side, do these just normal stretches to where you're loosening and everything up. Also, if you're able to stand and bend over and reach down and touch your toes to stretch and loosen up that lower back. Any type of movement, anything that you can do on a lower impact level to where you're not, again, making it worse for the fibromyalgia or the arthritis.
Right. Well, I know a lot of people that have the arthritis. You were talking about the leg extensions. They have that in their hips or in their knees. They might not be able to extend as far up, so they just need to extend
to the
where
point of where you're not in pain.
Right.
Right. You know your pain level and pain tolerance. You don't want to do anything again to damage, but you do want to do things to keep the joints moving for just good joint health.
And the same with the arms.
Same with the arms, right?
Okay.
Just do things to just keep moving. You can increase that. The more you do it, obviously you can increase your weight and increase the intensity or the times and the reps that you do it.
Okay. All right. Well, thank you so much
You're
for showing us
welcome.
those exercises. I know that our senior group today was really just in awe of the types of exercises they could do at their home,
Right.
and not really having to spend a lot of money on exercise equipment or anything, just in general things they can do at home to stay
It's just
fit.
physical activity, exercise and activity, move, like I mentioned, chasing grandkids, gardening, biking, anything. It doesn't require a lot. It's just simple, just staying active and moving, not just sitting to where you're just watching TV.
Right.
So.
Thank you, Brandee.
You're welcome. Thank you.
Thank you for joining us on our today's Health First program. If you would like additional information on this program or any of our other Health First programs, please feel free to contact us at 256-737-2600 or on our website at crmchospital.com.